Welcome back. Now, I'm going to be talking about a treatment program, comprehensive treatment program for ADHD. What would this really entail? What would your child really need? What would be important here? Well, I think first of all, I'm going to start off where I left off on the last section on this DVD. There's no question your child definitely needs unconditional love, needs emotional support, okay? But I think the things that you want to use strategies that are going to be helpful. Let's just use one, social skills, okay? There's no question that so many children that have ADHD have these social skills problems because they don't have the filters, they don't hear it right, they misinterpret it, they get all the negative reinforcement. So anything you can do to help here, and this could be done actually in the home by parents trying to give examples and working. You could be doing it. You could have a counselor at the school that sometimes has groups of children that have some problems interacting. You could have an outside therapist. But it would be one of the things that you really do have to do, okay? There could also be special school services. It could be special education, okay? It could be some type of a compensatory education. I mean, you just have a program to help in reading, okay? It could be using a tutor, okay? It could be a college student. It could be an older student. It could even be the same age student helping out doing tutoring, okay? And I think another is the teacher and the staff, the person's being aware of what ADHD is, like I mentioned to you. My friend who gave me these questions from teachers on ADHD. Obviously, a lot of these teachers do not know what it is. They're really not aware of it. So that's really something that is important, okay? Something important for teachers to be aware. And I think parents may need counseling. You know, we've been talking all along about what kids need. Well, listen, if you're a parent and you have an ADHD child and you have a child who's really struggling, then you may need help yourself. You may need some counseling. You may need to have someone that can really be helpful to you and advise you, an expert. And it's hard to find an expert, but someone who's really an expert in ADHD and its impact, on the family. There may be a need for some family counseling. You may need to have the whole family involved, particularly if you're not able to have these family meetings, if you really aren't able to get them going, if you're not quite sure, really, what to do, okay? Then you're talking here about the medical intervention, if you need that. We've talked about that in terms of stimulants. We're talking about whatever medication you might need, that you'll be then dealing with appropriate medical personnel. These are normally the family physician, the pediatrician, or a psychiatrist that would be doing this. But that's another critical aspect to make sure that that you have in place. You want to be dealing with what the school interventions are. What do they have? We mentioned before some of the things, but there are other things that they may have. They may actually, you could have the special education, of course. You could have environmental changes that they would have, changing with the child, sitting where they're doing, taking the child out of the room even for certain activities, bringing persons into the room, whatever it might be. Whatever the school might offer, I think that would be, a critical outlook. I think another thing, too, sometimes just having physical outlets for children can be very important, okay? Like being able to swim, run, just activities. Sometimes kids they have all this energy. And if the school, things like that can do that. Or you can do it in your home, too. I don't mean just the school. But where you're able to do this, okay? Then I think you want to make sure you have your child in activities that can be helpful. Sports, band, community service, whatever it might be. That involves the child in something he or she likes, what they can do. Martial arts, whatever it might be. A place where people want to see them, a place where they have success. This is all part of, the treatment, okay? Now, we can be looking at, I've mentioned before, in other parts of this program, the behavior modification, the token system, okay? Situation where you set up very specific consequences in a positive way. If you do this, if you, for the next hour, do not cause any problems with your sister, you will get a token. And this week, we're going to do this 10 different times, and if you do it each time satisfactorily, you'll have 10, and you will be able to go to the movie. There'll be no second chance. You'll have to wait till next week if you get 9. But work hard, and you might give 12 opportunities, whatever it might be. But behavior modification, okay? Use different strategies. You can do this in home, you can do it in a school, but it becomes important. And I mentioned before, cognitive therapy, changing the way someone thinks, what they're saying. We are what we think. And if you think I'm a dummy, as an example, I'm an idiot, I'm a clown, I'm a this, that's what you are. You need to get those thoughts out, say more positive, good things about you, then you will start, behaving, in that way, okay? And then in counseling, what happens is children the ADHD child really needs to learn coping techniques, problem-solving strategies, how to deal with the everyday stress, self-esteem type things. These are the things, of course, the kids are not good at. But again, you as the parent can be critical, but the school's critical. If you have outside counselor at school, and it becomes very important that everyone is working together. Everyone is working together, including the family physician the school nurse, whoever can be involved, the team. Good to have a coordinator, but you as the parent might be the coordinator, okay? And if you, of course, there are special education services, then it becomes critical that everyone be working together, but at least there's more support. There could be a teacher consultant or somebody who's kind of coordinating some of, the activities. But again, important teamwork, communication, everyone is working together, and that everyone is aware of what the problems are, and aware that these can last for a lifetime, and aware of the importance of really, working together. And the overall treatment plan, I might add, does require to have all the data that we've talked about before in a comprehensive assessment. You want to have the medical history, you want to have the developmental history, you want to have the educational history, you want to have the psychological history, you want all the information from teachers, from parents, everything that you can find, including other persons in the family, that have the really, same characteristics. Now, what I'm going to do here, and again, treatment requires that we have a whole bundle of choices, and we use those that work. Because another thing too is if you need tutoring, if you need outside tutoring, there's nothing wrong with that. Like I've said here, we use Sylvan Learning. Many children, many parents that I know do, and are very happy with the work that is really done there. And I'm sure across the country, other places, there are a lot of other places, and even in this area, we certainly have people that try to do good work. But it's important that we definitely, in the comprehensive, in terms of the implementation of strategies to help the child, that we have all this information together. And critical that somebody is aware of everything that's going on. I had an experience here some years ago where there had been a meeting on a child with ADHD, and no one implemented this planning meeting, an IEP, the Individual Educational Planning, okay? So people get together months later and nothing ever happened. Well-intentioned people, but no one had coordinated anything. So if you're going to be setting up and implementing a plan, you had better make sure someone is coordinating, and that there are times when people get back together. And then again, I think some of the basic things in the home, having planners, getting on the computer, many school districts now have the grades, have the assignments, work with the child, work with the teacher. All of these things are really critical in overall treatment plan. But it's very important that any expert that you need is involved. That all becomes very critical. Now what I want to do, this is another article that I wrote. I just want to maybe end some of this here with a situation. A question came to me. This was a child with a reading disability, also had the ADHD, and self-esteem was hurting, okay? And I just want to read the question that I got from the parent, and I'll give you the answer. And I think here you'll see a lot of the things that I'm talking about with a real example. Okay, my 8-year-old son has a reading disability and ADD. His self-esteem is hurting. He says his teacher gets mad at him because he's not aware of what to do, because he can't pay attention. And kids often laugh at him and his problems. Now, look at this. Teacher's mad at him, kids are laughing at him. That's a pretty bad way to spend a day in school, isn't it? His inability to pay attention and bad attitude when correcting him makes him difficult to deal with at home. So we already have an extension. He's difficult at home. This is a defeated, beat-up little kid every day. His reading disability also causes pain to him because he knows he's slower than others. He's now taking Strattera. Remember, that is the non-stimulant. It's one of the selective serotonin reuptake inhibitors related family, if you will, like Prozac, like Zoloft, like Wellbutrin. Okay. Special education support for his reading disability. Okay, that will begin. Okay, you'll get that. We're new to this and want to know what to do to help build his self-esteem. Our two other children do not have his problems. So look at all we're talking about here. Reading disability, ADD, low self-esteem, problems with the kids, teacher upset, problems at home. This kid has everything going. And this kid is only 8 years old. Now, without some good intervention and involvement, this is really a very bad outcome. Now, fortunately, in this case, there's been a diagnosis, there's been an evaluation, and there is some medicines being tried, some drug therapy. They're going to be implementing some of the special education services, whatever they are. But I want to read to you my response. Self-esteem is the view one has of self. If you love and respect yourself, you have good self-esteem. Good self-esteem will be in place if you believe you can succeed in life and believe you are worthy of being happy and having a good life. You'll have bad self-esteem if you do not love and respect yourself and always find fault with yourself. How others see you has a huge impact over time on your self-esteem. Because your son has problems with inattention or reading disability, he is seen to be a poor reader and someone who cannot or will not pay attention. These ongoing negative views over time do great damage to his self-esteem. Self-esteem in a person can be high in one area, such as social relationships, and low in academic achievement. Unfortunately, a person with both ADHD and a reading disability has a good chance to have low self-esteem in social relationships, academic achievement, and difficult relationships at home. This little 8-year-old struggling. Could be your son, maybe it is. Could be your daughter, someone like this. Look at all these things going on. Battered. Teacher thinks he's not trying. Kids are laughing at him. Trouble at home. Just this little person without any abilities, with some abilities, but struggling, not able to do what to do, just beating himself up and trying to struggle. Okay. I say it's positive his problems have been diagnosed and you are in the process of getting treatment medically and educationally. And so following are some things that can be done to be helpful, certainly with the self-esteem here, okay? Now, this again, what we were talking about in this particular section about implementing strategies. This is what we're looking at, okay? Work closely with the school to make sure home and school strategies to help him are similar and coordinated. Set up specified quiet study times on a regular nightly basis to help him better develop attention skills and improve his reading. You want to do both. If he's quiet, has a place, he can extend his inattention and also help his reading. And again, applaud when he does well and end a reprimand with a positive statement. Remember, I mentioned that before. For example, you did not do all your homework and I know you will tomorrow. I'll help you as best I can. Then be available to talk to him when he's feeling bad. Good parental bonding will make it easier for him to not be defensive and angry when you try to help him do better. Right now, he is defensive and angry. Then set specific and reasonable expectations with reasonable consequences, and if they are not met, that he knows, okay, and understands what it is. So again, you want to have expectations that are reasonable and specific, reasonable consequences, and if they're not met, he knows what's going to happen, okay? You want to have him involved in the process as much as you can. This can be helpful, having him take some ownership for his academic and behavioral performance. And that also can be done, remember we talked about before, family meetings, individual bonding meetings, talking, but working as a team and being unconditional, loving, and caring, okay. Be patient when giving instructions to make sure he knows exactly what he is to do. Problems with inattention often result with the person not getting the full instructions of what they are to do and thus ends up frustrating everyone involved. Over time, it can destroy or greatly damage relationships. Be patient when giving instructions. Make sure he understands. Once he has someone really helping him doing that, and you do that, it'll be much better for him. He'll learn more. And then you can talk to the teacher, whoever else, about what you have found to work. Generally, parents are the ones that often know far more about the child. Always do. Rare occasion it's not true. Teachers, counselors, psychologists, pediatricians, physicians, psychiatrists, whoever they might be, know the child, but no one knows that child like you do every day, and don't forget that. Okay. Then I put a tutor or a center, like I mentioned, Sylvan Learning, could help him with his reading disability. This would particularly be true if the problem is related to missing academic building blocks over time due to his inattention. Some people with dyslexia, reading problems, math problems, there's some type of a physical connection. We don't always know what it is, but they just can't do this. Or they have to memorize words, they do reversals. But there's a good chance this particular child, this little child, who, like I said, I feel bad even as I think about him there, out there wailing, his heart hurting, being punished, yelled at by everyone, and just doesn't know what to do, just kind of alone out there, actually. But he sounds like someone, he just, due to inattention, due to problems like that, mainly the inattention, not being able to always be in tune and touch, he's just missed a lot of building blocks. And hopefully through tutoring, Learning Center, he will be able to do a lot better. Okay. Closely monitoring the medication with his doctor to make sure it's appropriate. Always important to do that. Counseling may be necessary if his attitude and self-esteem get worse. May be necessary right now. This can be done in the school if available, as well as the community with a trained therapist and such matters. Now, this here is just a case. One that I wrote for the newspaper here, okay? But it kind of relates to everything we've talked about, doesn't it? In many ways. We're talking about self-esteem. We're talking about ADHD. We're talking about the impact that has. We're talking about a learning disorder. We're talking about a lot of different things, all in one case. And part of implementing any type of a strategy, any type of a comprehensive program, would take into account all of these things. They could be other, depending on what we're dealing with. But this is one, I think, that just happens to spell out what can be done with very specific strategies. So again, at this particular time, I'm going to leave this right here. And if you haven't already, I think the CD in this set that my son and I did, he being the school psychologist in Miami, Florida, with the same name, John, that where we ask many questions and answers and talk about them in relation to parents and specific situations in relation to the children that relate to medication, working with teachers, setting up specific strategies, dealing when two parents disagree on medication, which is really a very, really a tough one. In fact, that's even something I could talk on here in just a minute. It's really tough when you have parents that disagree, or one parent, and it really would be helpful. You just have to work with the parent. You have to work with them. Try to show them. Try to be helpful. If it really were, catastrophically negative, you can always look at legal, but that generally just leads to more turmoil. Most people are reasonable, and you just try to show what you can do in terms of helping. But again, that's a CD with a lot of good information I think could be helpful to you. But again, to this point, I'm happy that you've done what you're doing, and I want you to keep using over and over again these materials. I think the more you listen, the more you can pick up, because I really want to help your child. I really want to help you. So let's leave it here for now. Good luck, and let's go forward.